Can you guys introduce mommy?
Hi, everyone. Thank you for watching today's episode of Spill the Beans with Dr. Jill. I normally come on and do a reflection at the end of my interviews, but I wanted to switch it up in a very special way for this guest. So, for those of you that don't know, because I don't really talk a lot about my journey, but my doctorate is from New England College in Henniker, New Hampshire. It plays a very special place in my heart. I lived in New Hampshire for about 4 years while I was Dean of Students there at Franklin Pierce University. And I was able to really focus on myself. I literally went off the grid in like the woods and the snow and achieved this degree in an accelerated program. And I'm forever grateful. Well, when I found this practitioner was not only working at NEC, but also completing his degree, I had to connect with him. And I want to keep in mind that word connect because it's the word that he reflects on in his Spill the Beans. So, this practitioner is a counselor by trade, has experiences with law enforcement and the military, an amazing practitioner. But I want you to be open to the sales pitch that I've been giving you about having your own therapist or your own counselor to support your protective factors. I think that this practitioner does a really great job explaining why vicarious trauma is so important to understanding as a byproduct of the jobs that we do, and that you deserve to have somebody in your corner all the time, of course, in addition to me. So enjoy today's episode of Spill the Beans. Bye-bye. Hi, everyone. Thank you so much for joining on today's episode of Spill the Beans with Dr. Jill. As always, I'm going to ask my guests to introduce themselves to you.
Hi, I'm Dr. Brian Driscoll. I am a licensed clinical mental health counselor here in New Hampshire, and I am also the director of the Clinical Mental Health Counseling and Human Services program here at New England College, as well as the owner of a small private practice here in New Hampshire. So not only am I in academia, but I'm also out there practicing.
It's
So
very exciting to have you here. How many years did you go to school?
Oh God, that's a great question. Including my, for to be a clinician, that was about 2 years of education. Then you've got a couple years after that where you're focusing on getting, your licensure, getting your hours, the required components to lead towards licensure. And then with my doctorate, it was about 3.5, 4 years on top of that. So in total, probably close to 7.
Lots of education.
Yes,
Did
absolutely.
anyone ever talk to you about vicarious trauma?
Uh, Everybody. Not so
Oh,
much talk about it, but it has come up in so many circles. Just, my previous career, it was 24, 25 years or so between the military and law enforcement. So there was a lot of conversation about vicarious trauma in that world. And then here on the clinical side, it comes up all the time, both with interns and students.
like that actual verbiage, vicarious trauma, or the it's going on?
Kind of a combination of both, right? Because
Mhm.
sometimes we mistake burnout or we mistake complacency just as, oh, I'm just bored or maybe I'm tired, when in essence, it is vicarious trauma that we're experiencing. It's the effects of that traumatic response on the body
Yeah.
that's making us feel a little bit more tired. Maybe we're a little less engaged with our clients than we'd like to be. So I've heard some people say, yeah, vicarious trauma, and others that are just exhibiting the behaviors and the presentations of vicarious trauma.
Wow, this is a first. I think my audience members are going to be shocked because most people say, no, no one ever talked to me about it. I've been in school for years and years and years, especially the medical practitioners. And they'll say, we've got a lot of conversations about self-care, but not about this idea that I would take trauma from others or that I would evolve as a person. So this is a good new part of the series.
I
What
think what's
can,
interesting about that,
yeah.
though, and I'm sorry to cut you off,
No, no, go.
I think what's interesting about it is the conversation is there,
Mm,
but the belief that they may be experiencing vicarious trauma is often not.
yeah. Well, I talk with people about how I really want this to be like a badge of honor that when you get vicarious trauma, it's because of your heightened ability to have empathy and that you care for other people. But some practitioners and certain fields in the helping professions just have this wall up of nothing impacts me. I'm not weak. And I'm like, you don't get it. But we're trying. We're trying to educate as much as possible. Do you know how your vicarious trauma manipulates itself in you?
Oh, 100%. Typically, especially where, unfortunately, I'm one of those people that has never gotten the memo to
Mm.
cut down sometimes on the amount you're working or the
Oh,
amount, especially in a helping profession, right? Sometimes we're like, no, I got to continue to give. I got to continue to work.
yeah.
Um, and some of that, sure, past experience, it's, mission first. You go until the mission's complete. And usually with me, I tend to start to see myself shut down.
Mm.
I see myself looking maybe at my clinical schedule, or I see myself looking at my work schedule. And when I can feel myself going from a scale of, on a 1 to 10 at like a 7 or 8 in terms of whether or not I'm looking to cancel a session or
Mhm.
take a sick day or do something like that, I'm going, okay, I think I know what's going on here.
Yeah.
I'm reaching that point of fatigue. I'm reaching that point of burnout. Too much is kind of reminding me of maybe some of my own personal experiences. So
Hmm.
it's time to reflect. It's time to take some of those steps to minimize the effects of whatever's going on with me.
Yeah. Thank you for sharing that. Do you have a favorite self-care strategy that you do?
Oh my God. A lot of people like to balance mindfulness techniques and grounding, and those are the
Mhm.
buzzwords. We love that. For me, I struggle in the wintertime because self-care is getting out on a motorcycle and going
Mm.
for a ride, right?
Yeah.
It's going down to the beach. It's being present in the moment. It's really recognizing what I need when I need it, not pushing it off.
Mhm.
So you typically riding my motorcycle, just kind of disengaging from the clinical world, even
Mhm.
I could say even maybe for 5 or 10 minutes, just taking that breather. And sometimes, being an EMDR trained clinician,
Mhm.
sometimes I'll do some EMDR flash for myself just to kind of compete against what might be triggering me and what's going to help balance me.
The understanding of EMDR might not be known to everybody. It's the idea of, I don't want to explain it for them, but feel free. Can you elaborate a little bit on what EMDR is versus a traditional therapy session?
Yeah, I'll simplify this as much as I can. So,
Mhm.
a typical therapy session is we're going to sit down, we're going to have a conversation, we're going to talk about all these feelings, right? We're going to try and label them, we're going to try and address them and kind of process through them. Whereas in EMDR, we're taking a look at whatever a target memory might be,
Mhm.
and we're utilizing components of cognitive behavior therapy, exposure therapy, and dialectical behavior therapy to go, okay, this is the experience I've had.
Mhm.
Here's the negative belief that this experience has put on me. Here's what I would like to believe about myself as it relates to that experience. And we stay with that feeling, no matter what it might be, whatever somatic experience we might be getting in our bodies. We just go with it and we stay focused on it until it begins to neutralize itself.
And the
And
way that I understand it, Brian, is that you kind of have to talk about your past trauma in order to move forward with the EMDR.
believe it or not, you don't have to talk about it.
Okay.
So all I need to know as a therapist is here's what the traumatic experience was, right? And for,
Hmm.
let's say, a combat veteran,
Yeah.
I had these experiences in Iraq or Afghanistan. And I
Hmm.
say, okay, well, what about those experiences? Well, it makes me feel like I'm disconnected. It makes me feel like, I negatively, this is how I view myself now. And the question then becomes, what would you like to believe about yourself now? I'd like to believe that, no, I'm not disconnected, that I'm able to engage and that I am strong.
Yeah.
Right? Then it might be, okay, well, where in your body, as you're thinking about this negative experience, where are you feeling that? Oh, I'm feeling it in my lower back or my shoulders. Okay, now what I want you to do is I just want you to focus on those feelings altogether.
Yeah.
We're not going to talk about any specific specific incident or event. We're just going to go ahead and we're going to sit in that uncomfortability. There's no conversation really. There's very minimal conversation in an EMDR session. Now, and that is the full reprocessing. And I mentioned EMDR flash. That's a little bit different because all we're doing is we're saying, okay, on a scale of 1 to 10, I'm like a 5 or 6. I'm starting to fall apart here.
Yeah.
Let me balance. Here's the negative thing. Now let me go to something that's a little bit more soothing. And for me, it's always the beach. So for 2 or 3 minutes, maybe I'm going to focus strictly on the beach and I'm going to go and work through all of my senses, all 5 of them. What am I seeing? What am I hearing? And it can be a real or imaginary place. But as opposed to just forgetting about the thing and pushing that off to the side, after 2 or 3 minutes, I'm going to push the beach off to the side and I'm going to bring in the stressful trigger and go, okay, am I still, as I'm thinking about this, am
Mm-hmm.
I still at a level 5 or 6 or is it going down? So I'm balancing, and what I'm doing is desensitizing myself to that trigger, and I'm able to move forward with both things simultaneously.
This season has been dedicated to the medical profession. And
Mhm.
every episode, I always talked about the protective factors. And one of them is being able to talk to someone like a therapist and a clinician. So I really wanted you to be able to talk to D about EMDR because I do talk about how some of the techniques in that process can really help us to process our vicarious trauma. And I want individuals who are watching to see that it doesn't need to be so complicated or scary, and that having kind of like someone, your person, to be able to vent to is so helpful. And so you're kind of humanizing words that they might have heard and making things not so complicated. So the strategy that we're going to push is be open to self-care in talking to a practitioner. You like to get outside and see nature and reconnect. And if you had like a mantra or a quote or some advice that you have, I call it like if you had to spill the beans on vicarious trauma, what would
Yeah.
you leave us with some words of wisdom?
You know what? I'm going to give you one word, and that's connection. You know,
Oh,
so,
tell us. Yeah.
so much of what we do when we think about things, and you kind of hinted around it, right? That there's not this big focus on vicarious trauma, and there's this largely a focus on, well, wait a second. No, I understand it's a concept, but it's not affecting me, right? So really, connection through different systems, meaning we're not just focusing on, mindfulness, and we're not just focusing on grounding or yoga, that we're instituting a connection and a team approach within the system to say, hey, here's a place where we can get these feelings out. Here's a place where we can get the psychoeducation that we need to understand that the more I give and the more I help, the more that I am going to internalize, the more I am going to feel, especially if you're empathetic to your clients and your patients. We have no choice but to feel that way,
Yeah.
right? Especially if we're going to be good at what we do.
Mm-hmm.
So normalizing it, validating it that, yeah, guess what? It's not a big deal. I like to say to my clients, and students, which is we're not goldfish crackers. We're not devoid of emotions, right? We are able to have those things. So embrace it, but don't sit in silence. Connect. Build connections through each other and through teams, especially for those that are leading teams, especially in the medical world, because that is one of the gaps, right? Is that we don't teach enough about the neurological or neurobiological impacts of trauma or vicarious trauma on providers. So understanding how we're internalizing it and being able to provide that kind of being able to provide that system for people to get in touch, especially when we are looking at these systems that are wholly focused on client outcomes
Mm-hmm.
without a focus on provider outcome and provider capacity to be able to provide the help that clients and patients may need.
Beautiful soundbite for me. Thank you so much for all of that information. Thank you all for watching. I hope that you really enjoyed today's episode, and I hope that you stay connected. Thanks so much.